They said your congestive heart failure is chronic. At best, you can keep it the same, but they told me it's never going to get better. The biggest regret I have of all of these is 100% the statins.
Most doctors don't think it's possible to reverse this, to improve it. Doctors are in a bubble.
We're joined by Kerry, who's been eating only meat for 1,000 days.
And renowned heart surgeon Dr. Ovadia.
To have a crucial conversation about carnivore.
And reveal the truth about what meat and saturated fat really do to your heart.
What was life like before you started carnivore?
I was very sick. I'd have lean protein like chicken.
I was a morbidly obese, pre-diabetic heart surgeon.
I was 100 pounds heavier than I am today. I suffered from depression, anxiety, arthritis, IBS. I just had mounting health issues that got worse and worse.
I was going to end up on my own operating table, so to speak.
Dr. Ovadia, do you think high fat can really fix the heart as a heart surgeon?
Yes, so ketogenic diets, ketones, are beneficial for the heart. The plaque that builds up in the arteries and can lead to things like heart attacks. The clear underlying driving root cause of that is insulin resistance.
I highly encourage people to get some of these tests. 8 years of statins. If I would have had a CAC scan and an advanced lipid panel, I would have made different decisions about the medications that I was going on.
So Kerry, you have been eating meat only for 1,000 days. What is now happening with your heart?
It's really interesting, Rena. So
If you care about your heart, here's the number one thing that you're going to hear from your doctor. Drop the saturated fat and drop your LDL cholesterol. Yet heart disease is still the number one killer worldwide. So, is your doctor wrong? Today I'm joined by the wonderful Dr. Philip Ovadia. He's been a heart surgeon for over 20 years. He's done over 3,000 heart surgeries. And we're also joined by a real-life patient, Kerry. He had heart failure. Both are high-fat, both eat fatty meat, but one quit something. Your doctor will never tell you what you're about to hear. And if you'd like to see more conversations like this one, comment heart below. So Kerry, let's start off with your story. What was life like before you started carnivore?
Before I started carnivore, I was in rough shape. I was very sick. I was 100 pounds heavier than I am today. I suffered from depression, anxiety, arthritis, IBS. I just had mounting health issues that got worse and worse. And in my 30s, I suffered a TIA mini stroke. I spent about 5 days in the hospital, and they did a bunch of tests on my heart because they're like, what's wrong with this guy? So many health issues, so much medication. And they diagnosed me with congestive heart failure. My ejection fraction was 44. I think something like 40% of my heartbeats were also premature, and diagnosed me with cardiomyopathy. I was always dizzy and I'd stand up and I just never had any energy. So I had lots of health issues before starting carnivore.
I can imagine. Now, I know that your health has drastically changed now, but I'm curious back then, what did your doctor say to you?
It was hopeless, honestly, with the doctors. They said, first when they told me you had congestive heart failure, I didn't really know what that was. I thought, I'm dying, like failure, my heart's failing, like I need my heart to be alive. So it was somewhat hopeless. And a lot of the health issues, including the heart health issues, were sort of presented in a way that this is just a fluke, it's genetics, we don't know, there's nothing you can do except here's some medication for you. So it was very, very hopeless.
Dr. Ovadia, is this something that if a patient goes to their doctor, they're going to experience a similar conversation with the doctor, hopeless, nothing that you can do?
Yeah, unfortunately, that is a conversation I hear repeated often when I'm talking to patients about their experiences with their physicians. When we look at heart failure in particular, it's, just felt to be a progressive decline. And the best that we can do is manage that and hope to slow down the decline, using things like medications mostly. And most doctors in that space don't think it's possible, right, to reverse this, to improve it, to get results like Kerry has gotten, and results that I've seen in other patients within my practice in similar situations. And the fact is, when you put patients on medicines, but don't address the underlying root causes, you don't see those types of results. You don't see things turning around and getting better. And so, unfortunately, most of the doctors in this space don't even realize that that's a possibility. And it is very disempowering. It does take away the hope from the patient. And I think that's, very problematic.
Got goosebumps kind of there when Dr. Ovadia was talking, because what he said was exactly what they told me. They said your congestive heart failure is chronic, and at best you can keep it the same, but they told me it's never going to get better. So yeah, it was quite hopeless, and it was exactly like Dr. Ovadia just said there.
I think that most people would feel the same way, that when they go to their doctor, either if it's their LDL cholesterol or a cholesterol conversation is about that, or their heart, but this is to empower them that there is an alternative and we can fix ourselves, with the likes of Kerry and Dr. Ovadia's book as well. So Kerry, tell us, what were you eating before Carnivore?
I was eating a standard American diet for a long time. Then I found a ketogenic diet about 15 years ago, and I had some success with that, but it was like I was trying to moderate my addiction. I would do well for a little while, and then I'd end up eating more and more. And before starting Carnivore, at one point, I was doing basically a whole foods ketogenic diet, mostly plant-based. I would have a salad for lunch, a salad for dinner, and I couldn't eat any red meat because I was told my entire life that was going to clog my arteries and give me a heart attack. I already had congestive heart failure, so I'd have lean protein like chicken. And I did that strictly for a year, because a lot of people will say, well, you just got better because you got rid of the junk food. I went for about a year just eating salad and protein, and I still had all of my health issues.
And then how many medications were you on so that people get a feel of how bad your health was?
Yeah, at the worst, I was on 15 medications. These here. And those were medications. A lot of those were for depression, anxiety. I took medications for sleep, medications for acid reflux, gout, arthritis. But a lot of those were for my heart. I was on statins for about 8 years. I was on metoprolol, flecainide, all sorts of heart medications, beta blockers. And the biggest regret I have of all of these is 100% the statins that I took for 8 years. I really feel upset about that. I was misled with some of the marketing they do around statins. I remember hearing a stat saying something like, you have a 40% chance of reducing heart disease by taking the statin. But I didn't understand that there's a relative percentage you can look at, and there's an absolute. And when I learned that, and I learned that only 1 in 100 people actually see a benefit from a statin, I never would have taken those. I had all sorts of side effects, and I didn't know because I was taking so much medication. But I had brain fog, and I had muscle aches, and I had fatigue. And in retrospect, doing that for 8 years, I feel like a lot of that was from the statins, which I wouldn't have taken if I actually knew the actual numbers around them. But they're very misleading in the marketing. I remember seeing TV commercials years ago, like 40% reduction in heart disease if you take these statins, and it's really, really misleading marketing. And I had those immediate side effects then, but I wonder now, like long term, all of these medications that I was on, I really believe these come at a cost. And sometimes we can't see the cost immediately, but maybe it takes 20 years off my life, or maybe I end up with dementia or something else down the road from that cocktail of medications I was on. It's really hard to know, but the statins are a big one that I have a regret for sure.
I do want to talk more about statins. Dr. Ovadia, something you want to say?
Yeah, I just, Kerry brings up a great point, right? And honestly, we focus a lot in this community on statins and on cholesterol. But I would say that those same things apply to probably most of those medications that Kerry was taking, and that most people end up taking, right? These methods that the pharmaceutical industry uses that largely overstate benefits and understate risks. And, the reality is that someone like Kerry on 15 of these medications there's no studies that show how these things interact with each other. It's rare that maybe two medications might be studied to understand their interactions, but certainly no one's doing studies to figure out, all the different combinations of these medicines and what effects they have. And, what oftentimes ends up happening, and wouldn't surprise me, right, if this was sort of Kerry's progression, is, you start on a medication and something else happens, right? That doctors may not attribute to the first medication, but may be due to the first medication. And then they say, okay, well, we have another medication to treat that problem, right? And this keeps happening like over and over again. And before you know it, like Kerry, you're on 15 medications, and a lot of the medications aren't treating problems that you originally had. They're treating the side effects from the other medications. And again, I see that over and over again. And, one of the things we try and do in my practice is get people off as much medicine as possible. And, to be honest, I am amazed, like, if I could take myself from 10 years ago as a physician and, show that person what is happening today, we're getting people off all of these medications and they get better. I wouldn't have believed it. And I don't think the average physician out there has any idea about what is possible. And that, again, a lot of the medications probably are at best neutral, not doing anything to benefit the patient, maybe not harming them. But most of these medications are having side effects that just sort of get thrown into the disease process. Statins are a great example of that. I think, we have a lot of robust evidence of that, but I think it applies to a lot of other medications as well.
Definitely a conversation that it's hard to have with a traditional doctor that just wants to medicate people and pill after pill. But as you said, the interactions can be devastating, especially when you're on multiple medications. I'm sure people watching will be on multiple medications, but there is hope. As Kerry, how long have you been eating meat only for? How many days is it?
I'm approaching 1,000 days of eating only meat.
Dr. Ovadia, how many days have you been carnivore eating meat, if you know that number?
Yeah, I mean, and I'll admit I'm not as strict as someone like Kerry because I don't necessarily have some of those underlying problems. But I've been doing what I would say is we'll call it a carnivore-based diet now for about 8 years.
Perfect. And Kerry, right now, are you off all of those medications that you just showed us?
I'm off every single one of these medications, yeah.
Amazing. Dr. Ovadia, my next question. Why do you think some doctors hate carnivore?
Honestly, because they have the same bias, right, that we all have, that we've heard that red meat is bad for our health, right? And it's bad for our heart health. It, increases risk of cancer, and all these health issues that have been attributed to red meat. Doctors get that same messaging, that same programming, and they just don't have the wherewithal, the curiosity, or the time to look into the alternative information that we all know now. And again, I understand it, right? I believed those same things as a physician. And it was only, at first my own personal health journey, and then seeing, patient after patient improved with this way of eating, that I have been able to undo that programming. But we have to understand that, doctors are in a bubble. They only get one side of the information, and that has just biased them against eating red meat in general, I'll say. And therefore, the carnivore diet, where you're only eating red meat or eating large amounts of red meat with little else, seems absolutely crazy to them. And there's no way that could improve health in their minds.
So with that question, I'm not generalizing every doctor because we know that with the whole, I guess, movement towards carnivore, ketogenic diets, that there are a lot more doctors very well known around the health benefits of red meat and butter and having higher LDL. There's just still a lot of doctors that still poo-poo carnivore and poo-poo eating red meat, as we see with many people when they get scared and fear-mongered when they see their doctor. Dr. Ovadia, I want to hear your story. You wrote a fascinating best-selling book, Stay Off My Operating Table. Amazing. Kerry always talks about Dr. Ovadia's book. Why did you write that book?
I wrote that book to get this information out to as many people as possible. As a physician, even with a busy telemedicine practice, and I see patients all throughout the United States and all throughout the world, right? And I have an amazing team behind me, but we can only see so many patients. And we need to get this information spread more broadly, right? And doing things like writing books, the documentary that Kerry's working on, all of these are all avenues to get this information out to more people. And, the more people that hear this, the more we see the movement growing, right? When you talk to individuals about this, it actually makes sense. Like most people, and I'll be interested to hear Kerry's reaction, right? But when I'm talking to someone who's never really heard about carnivore, low carb, right? And you just have that basic conversation with them, it just makes sense. And almost instinctually, right? Their human instincts come out and they're like, yeah, I want to eat meat. I love eating meat, right? But I've been told it's bad for me, so I don't eat meat. So it's not hard to convince people about this, but they need some validation. And, as I had my own health improvement and, you know, started getting involved in this movement, we'll call it, right? Started speaking at conferences and started my practice. I realized that because I am a heart surgeon, right? Because I have been in this medical system, it does carry some more weight. And it was important that, I get that information out there. So that's what led me to write the book, Stay Off My Operating Table. Special sneak preview for your audience. My second book is coming out next year. It's going to be called Stay Off My Kitchen Table. And it's actually available for pre-order now, and we can talk about that later on. But anything that we can do, right? The movies, the books, the conferences. Kerry and I were, just together at a conference a few weeks ago, which was amazing. Probably the largest sort of metabolic health centric conference I've been at yet. There are some other ones coming up soon, and it is exciting to see this growing. It's exciting to see more doctors interested and in the space and at those conferences. And it's exciting to see more people like Kerry who have just had amazing health transformations or are looking to have those and are open to this idea and they're very curious and they come to the conferences.
Absolutely. Can you share specifically your story? Because we are here because we all have our own story on how meat and red meat and high fat saved our lives. Dr. Ovadia, what is your health story, your journey?
Yeah, so I was a morbidly obese, pre-diabetic heart surgeon, and I understood and realized that I was going to end up on my own operating table, so to speak. I, was going down that same path that I had seen my patients follow. I have family history, I have all the risk factors, and I came to that realization that I didn't know how to fix this. Right. The advice that I had been giving my patients and the advice that I had been following myself wasn't working. And I think I was eating better than the standard American diet. I was largely following sort of the food pyramid, and I had done, the eat less, move more, count my calories, and I'd lose some weight and I would gain it back and gain more. And I just found myself getting more and more unhealthy. And I was fortunate through a couple of different avenues to get sort of directed towards low carb keto. Part of it came from my wife, who was dealing with what turned out to be gluten sensitivity. So we went gluten free. And then I heard Gary Taubes talk, ironically enough, at a heart surgery conference. And he, had just written at that time The Case Against Sugar. And that's what really led me down my, initially low carb keto and then ultimately to carnivore. And I've also, I've reversed my pre-diabetes. I'm down about 100 pounds, compared to my highest weight. And I've been able to maintain this and continue to feel better today, in my early 50s than I did in my late 20s and early 30s when I was morbidly obese and pre-diabetic.
Amazing. Hallelujah to eating meat and red meat and butter, what it can do for Kerry, Dr. Ovadia, and even myself. Haven't even shared my story, but people probably know my story. Dr. Ovadia, bold question for you. Do you think high fat can really fix the heart as a heart surgeon?
Yes. So, when we look specifically at what Kerry had, heart failure, we do have scientific evidence showing that ketogenic diets, ketones, are beneficial for the heart, for the failing heart. It is actually a preferred energy source and can help with that condition. When we broaden out, right, to what we more commonly refer to as heart disease, atherosclerosis, the plaque that builds up in the arteries and can lead to things like heart attacks, the clear underlying driving root cause of that is insulin resistance. And we know that low carb, high fat diets do a great job at reversing insulin resistance. So, those are just some of the pieces of evidence that as a physician, I am confident in saying a, carnivore, ketogenic, low carb diet can help with heart disease. And I now see it every day in my practice helping with patients with heart disease.
Now, as Dr. Ovadia mentions, high fat and being in ketosis can prevent heart disease by fixing one thing, insulin resistance. And while heart health is really important, one topic that not many people talk about is our mental health. And there has been an explosion of people suffering from things like anxiety, depression, ADHD, or just not having motivation or drive. And I know this because I spent most of my life living in anxiety, overthinking. And what completely changed my life, along with going high-fat carnivore, was therapy. Because I was like you. I would chat to my family and my friends, but their advice would make me feel stuck and judged and somewhat biased. Well, that's where speaking with a credentialed therapist really helped me. First of all, there was no judgment. It was an outside perspective that completely changed the way that I think. And my therapist gave me life-changing tools, things like deep breathing, self-soothing techniques, and a reframing activity, which basically makes you think, well, what if this thought wasn't true? And let me just explain this. You know how sometimes you have a really strong thought? And for me, it was, well, I'm just not good enough. Or there is no way that what I'm about to do is going to work out. In this example, you look at this thought, and my therapist made me think of all the times that I've achieved what I want to achieve, even if it was small. And this little small exercise changed the way that I think. It's really hard to express how much this work has helped me, but if you're in a position like I was, well, that's where today's paid partner, BetterHelp, comes in. BetterHelp is on a mission to make starting therapy easier. They'll connect you with a credentialed therapist who is trained to listen and give you practical, unbiased guidance. And getting started, it is really simple. Just fill out a short questionnaire and you'll be matched with a therapist in as little as a couple of days. From there, you can connect with however feels most comfortable, whether it's text, phone, or video, and even switch therapists at no extra cost if it's not the right match. So if you've ever felt stuck or if you need support, BetterHelp makes it easy to take that first step. You can start today by clicking the link in my description or visiting betterhelp.com/primal podcast to get 10% off your first month of therapy. Perfect. Well, let's not stop at the heart surgeon. A real life heart patient, Kerry. Do you think high fat can fix your heart?
I have no doubt of it now. Yeah. It's completely healed mine. I reversed my congestive heart failure. My ejection fraction's normal. Blood pressure's normal. And one really crazy thing with me was I had a lifelong irregular heartbeat since birth. And I've had heart monitors on probably 20 times throughout my life. It's always been highly erratic heartbeat. My heartbeat has also normalized after 1 year on carnivore, which I can't even really wrap my brain around. But beyond me, like I've shared my story online with others, and I've had countless people reach out saying the same thing. I went carnivore, I fixed my metabolic health, and reversing irregular heartbeats, reversing congestive heart failure, improving ejection fraction. I've heard story after story. It's a weird thing because most people diagnosed with congestive heart failure aren't going to eat only meat. So it's not really studied, but it's something I hope we can definitely get the word out about.
Absolutely. It's a bit opposite to what you'll hear, high fat and heart, because we're just told the opposite. Let's now talk about your results so that people can get hope if they're just 0 day, not even started carnivore or even a ketogenic diet. So Kerry, can you walk us through your first 30 days? What happened when you just started eating meat?
The most amazing thing that's ever happened to me in my whole life. I was suffering for so many years, and really quickly after starting carnivore, I started seeing results. Everyone's different. I think I was blessed to maybe get more results quicker, but I stopped snoring almost immediately doing carnivore. And that blew my mind, and it made me really happy because I was using a CPAP machine for years, and I hated that thing. Like I got to strap this mask to my head every night before going to bed. And I was told, like, you just got to lose weight. My neck was big. I was 100 pounds heavier. So I always thought it was because I was obese that I was snoring. But I learned later that was just inflammation. And inflammation goes away so quickly when you're eating a proper human diet. So that happened really quickly. And then a couple of weeks into carnivore, I had this lower back pain for decades. And I thought it was just like an injury I had when I was younger. That went away. And that too was inflammation. And I think about 3 weeks into carnivore, I remember telling my wife, I'm like, I can't feel my stomach anymore. It just feels like air. Like there was always pain or bloating or something there. And that just went away. And my depression didn't go away within 30 days, but I remember around 3 weeks, my mood just being better than it had in probably 20 years, noticeably better than any of the medications had ever done for me. So that was quite impactful as well within the first 30 days.
What about your insulin, fasting insulin, blood sugar, any changes in that?
Yeah, so those weren't things I measured during the first 30 days. But I feel like they all improved. I feel like they had to. The other thing that I've learned afterwards, and this was probably a year after, I was talking to someone and she said, you know, Kerry, you probably had fatty liver disease. And I was like, I had a lot of diagnoses, but I don't remember getting that one. Long story short, going through all of my medical records, I actually was diagnosed with fatty liver disease. And that was something I recently learned. Many people can reverse that really quickly eating carnivore. Dr. Saivas has talked about this before where he's proven it in the lab, like doing surgery, like even within like a week or something like that, you can start reversing fatty liver disease, which there's an epidemic of that going around as well. That's one of the interesting things with carnivore. Like a lot of people feel like, oh, I don't need to lose weight or I don't need to do this, but they don't realize insulin resistance, inflammation, fatty liver, visceral fat, all of these things that are going on internally. And I'm like, oh, I'm just fine. I'm a little overweight, but I feel like I probably also reversed fatty liver. It wasn't something I tested during the first 30 days, but many improvements.
In just 30 days. And what about your 1 year results, if you can recall those? What happened in 1 year?
Yeah, 1 year blew my mind. I felt so good after 1 year. At that point, I was off all of my medication, and I worked with the prescribing doctors to do that safely, especially with the antidepressant medications, which is really important. But I felt so good after 1 year. I'm like, I feel like I could run a marathon. And now prior to carnivore, the congestive heart failure, some of my symptoms was I would just get tired so quickly. Stand up, I'd get dizzy. I was always fatigued. And I think with congestive heart failure, it's like your heart can't keep up with the needs of your body. After 1 year on carnivore, I'm like, I could run a marathon. I don't feel like I have any limitations whatsoever. And so I decided to go to the doctor for the first time in my life without anything wrong with me. I'm like, I just want to see, because those doctors, like Dr. Ovadia said earlier, they told me congestive heart failure is chronic and I'm going to have it the rest of my life and it would never get better. I'm like, I think it's better. I want to prove it. So, and the other thing was my wife and I were watching a movie. She had her head on my chest and she's like, your heart sounds happy. Your heart sounds normal. And I'm like, I have an irregular heartbeat. How can that be? I actually went out and bought a stethoscope and tested it. So I went to the doctor for the heartbeat and for the congestive heart failure. And long story short, they did an echocardiogram, all sorts of tests on my heart, and it completely reversed. My ejection fraction went from 44 to 60. My irregular heartbeats reversed. My blood pressure normalized. The doctor wrote, "You no longer have evidence of cardiomyopathy." That's actually in my medical record. So after 1 year on carnivore, I had indeed completely reversed my congestive heart failure, my cardiomyopathy, irregular heartbeat, and all those other health issues as well. But yeah, my heart was just completely healed to the point, like, I feel like if I could have the best cardiologist in the world look at my heart, they wouldn't even have been able to known that I was formerly diagnosed with congestive heart failure or irregular heartbeat. Like, it's just perfectly normal now. It's crazy.
What about now 1,000 days only eating meat? What is now happening with your heart?
It's like my wife said, my heart's happy for the first time, and it's kind of a representation of my overall metabolic health. Like, it's really interesting, Rena. So I did a sort of a recreation on my YouTube channel of my heartbeat using our latest technology, but I had EKGs, I had all sorts of heart records, like 40% of my beats were premature, I had a heart murmur. So I actually recreated what my heart sounded like before carnivore and then after, and that's the best way to describe it. It was just erratic and crazy before, and now it's just perfectly normal. It's completely healed. Like, I'm exercising, I'm doing things I've never done my entire life. I feel like I'm 20 years younger, and someone told me early on, it just gets better and better the longer you do it. And I thought they were overhyping things, but it's the truth. 1,000 days on carnivore is better than 900 days on carnivore. I feel better and better. Like, my energy, my mood, everything just keeps getting more and more improved.
Now, in case you want the proof, here is Kerry's irregular heartbeat before carnivore and what happened after going carnivore. The change is truly incredible. Well, as a fellow carnivore, I can totally agree. Dr. Ovadia, what about your results? 30 days, 1 year, 8 years down the track, what's happening for you?
Yeah, so obviously the weight loss and now the ability to maintain that weight loss is maybe the most obvious uh, thing about this, right? That's different. My blood results, look great, right? With I think any traditional doctor looking at them would be happy, except maybe for my LDL cholesterol level. But I have, done now multiple coronary artery calcium scans over about a 5-year period, and it has remained zero. And like I said, I'm not genetically blessed. I have a family history of heart disease. I have siblings that have non-zero coronary calcium scores. I know some people would like to say, "Oh, you just have good genetics." I can reliably say that that is not the case. And like Kerry said, I mean, I have, more energy. I think back to, before I did this, before I underwent these changes, right? And I would do a surgery and I would go sneak off to my office and have to take a nap because I was so tired in the middle of the day. And just, sort of the brain fog that, people don't even realize they exist in until it gets lifted. And now, I mean, I can go, all day operating or doing things and just seem to, like Kerry said, have an endless supply of energy. The numbers are great, right? And I think they're always exciting to look at for people, but it really comes down to how people feel, right? And the energy. And it's just something that's very striking to me because I have the experience, right? Maybe a unique experience that I still live very much in the traditional, medicine world, right? I still do heart surgery in the hospital, and you just sort of see the energy around there, right? Versus the energy from something like, this conference that Kerry and I were at a few weeks ago, and it's just worlds apart. And so that's what I think is most interesting and inspiring. We started this off talking about hope and just the hope that people have and get from learning about this and doing it and experiencing it. That's what's really, just inspiring to me every day, is seeing that in my patients, and seeing that in the people that I talk to about this.
Amazing. And I think that hope is translated, hopefully, to my audience. I'd love to know from you, what are your results that you have achieved? Kerry, Dr. Ovadia, and myself. I'm female, so it's not just male. I've also got incredible results. But if the audience wants to share in the comments anything that you have experienced, the more that we can share, the more that we can help this movement go on. You mentioned some specifics around LDL. So as a heart surgeon, I want to ask about the true cause of heart disease, because people think it's LDL cholesterol. Dr. Ovadia, can you help us here? What is happening with LDL cholesterol if you go carnivore and it increases? Is that a concern?
Yeah, so to understand LDL cholesterol, and its impact on heart disease, it is part of the process, but it's not, as we understand it, that the higher your LDL cholesterol is, the more at risk you are of heart disease. The influence of insulin resistance, the influence of inflammation on your LDL cholesterol, is really what turns out to be important. And, this takes a little um, deeper understanding and deeper testing of your cholesterol. The way that I explain it to people is it's about the quality of your cholesterol. It's not about the quantity of your cholesterol. And again, most doctors don't understand that, don't get to see that because they're not doing the right testing and looking at things like your LDL cholesterol particle sizes and particle distribution is what turns out to be important. And then, when we say, okay, well, what changes that? We lead to insulin resistance and inflammation. So those are really the underlying root cause issues that we need to address, and we need to understand if we're going to understand this relationship between cholesterol and heart disease. What I try to tell people is it's not about how much cholesterol you have, it's the quality of that cholesterol, it's the environment that the cholesterol is in. That's what we need to pay attention to and manage.
Okay, can you give us some tests? So if someone goes to their doctor and instead of just asking for LDL-C, which is that generic one that they'll always test, what is the thing that they have to ask the doctor?
Yeah, you want to ask your doctor for what's either going to be called an advanced lipid panel, or it will be called an NMR, nuclear magnetic resonance lipid panel. And that's going to give you those particle sizes. And it's going to give you usually a particle distribution that will be called either pattern A or pattern B. Pattern A meaning that you have more of the large, buoyant, large, fluffy LDL particles, which are not in any way harmful. They are what are called non atherogenic particles. That means that they do not get involved in plaque formation. Pattern B means that you have more of the small, dense LDL particles. These are atherogenic, so they are concerning. But when you're looking at your LDL-C, you don't know which ones you're looking at. They both, go into that LDL-C level. So that's one test to ask for. Excuse me. The second test to ask for is a measure of insulin resistance. And there are a couple of different ones you can use. You can get your fasting insulin and your fasting glucose level, and you can calculate what's called a HOMA IR score, HOMA IR. You can get a insulin and a C peptide level, and you can get your insulin resistance score. Or you can do what's called an LPIR test. This is called lipoprotein insulin resistance. And that is a test that's looking at those particles and determining how insulin resistant you are, based on the quality of those particles. So lipid quality, insulin resistance, and the last thing I would throw in there is a measure of inflammation. And again, CRP, C reactive protein, is the most common one, but there are some others as well that we'll occasionally use.
Now, as Dr. Ovadia mentioned, there are some advanced tests that you can do to easily assess your heart risk. But this conversation also extends to fixing other aspects of our health. For example, toxins. We often focus on chemicals in our food. And if you're low carb, keto, or carnivore, well, you're already on top of that. But what about the chemicals in our skincare? Go have a look right now. Look at your body wash or anything that you put on your skin, because chemicals in those products that you apply to your skin can enter your bloodstream, reach your brain, and penetrate your cells, potentially causing long-term health issues. And when I found this out, that really made me stop and think, because I have healed so much through the primal lifestyle, but I realized I was still exposing myself to these harmful chemicals in my everyday skincare. And that's why we launched the Primal Tallow Balms and Soaps, our chemical-free skincare line packed full of vitamins A, D, E, and K2 without the nasties. There's no preservatives. There's no artificial scents. There is just one ingredient: pure grass-fed, grass-finished tallow. And I've been using the unscented soap and tallow balm, and honestly, it has been a game changer for my skin. Both products have improved my skin texture, my hydration, and a little goes a really long way. For example, this tallow balm I've been using for 2 months. I use it every day on my face and body. And great news, our USA store is now open, which means faster shipping and lower prices. And for a limited time, my new customers get an extra 10% off already reduced prices at the Primal. Just use code PRIMAL10 at checkout. So to try our tallow soaps and balms, just head to theprimal.com/10. There's also a link in the first line of the description. Okay, Kerry, I want to know about your blood markers, because you just did a video going through your blood work. How is your blood work now, and how is your LDL cholesterol?
My blood work is good now, and we were talking earlier, Dr. Ovadia was saying sometimes when you have conversations with people and they really start to get it when you talk to them. That's what happened for me when I heard Dr. Ovadia early on mention what he did earlier. It's the quality of our cholesterol that matters more than the quantity. It's like, that makes a lot of sense. That's what I've learned too. And huge thank you to Dr. Ovadia. I did my advanced lipid panel. I didn't even know what that was before. I was on statins for 8 years. I wish I would have done something like that before going on statins for 8 years. And I came back with the pattern A, which is the better one. And then I felt so good. But just because I'm doing this documentary and I'm out in the public, I'm like, I'm going to get some more tests done. I also did my CAC scan, and that came back as a big fat 0. And I didn't know about that until I learned from Dr. Ovadia as well. And that one, I highly encourage people to get some of these tests. I thought these were inaccessible. I thought a CAC scan, I'm going to have to go to the cardiologist. I'm going to have to get a referral. This is going to cost thousands of dollars. I literally Googled CAC scan near me. I found a place. It cost me $50 out of pocket. And it was like a 15-minute procedure. It was the simplest thing in the world. And again, I'm like, 8 years of statins. If I would have had a CAC scan and an advanced lipid panel, I would have made different decisions about the medications that I was going on after that for all of the heart medications. But yeah, my heart looks incredible. I was really excited to see the 0 CAC score. I wish I would have had it earlier, because I almost wonder if maybe it was higher earlier. I've talked to a lot of carnivores that have had subsequent CAC scans on carnivore and actually seen it go down, down, down all the way to 0. So I might have had a score before that, but it was the first one I ever had. So.
Well, I think it's just good to understand the logic by the doctor, but also to see the real life results from one real life heart patient and a carnivore. So curious around the thought, somebody might say, well, if I eat a lot of red meat and butter, it's saturated fat. So question for you, Kerry, do you think that in your experience that the saturated fat is going to lead to a ruined heart and heart disease?
I don't think that at all. I think we have been eating butter and saturated fat since the dawn of time. It's only just a small fraction of all of humanity that we're eating all of these other things like margarine and seed oils and processed foods, and we're all getting sick. So I really feel like it was the opposite for me. It wasn't until I added that fat back, because like I said before this, I was doing strict plant-based keto diet. I had almost no fat. I had lean protein and I had salad. Once I added the fat back, it was almost like my body was thanking me, like it was screaming like, yes, you finally figured this out. My sleep improved, my immune system got stronger, and it all makes sense because fat is the building blocks for our hormones. Our brains are made of fat. It's like we need fat. It's been demonized for so long. And if you look at groups of people that have very little saturated fat, there's usually high rates of depression, anxiety, fertility issues, and all of those are related to our hormones. So, yeah, I feel like we've been criminally misled on fat. I've eaten nothing but fatty meat for 1,000 days. I'm absolutely thriving. And it's not just me, though. There's thousands and thousands of other people that are doing this and finding incredible healing for all sorts of health issues.
Absolutely. Even the likes of Dr. Georgia Ede, she's a Harvard-trained psychiatrist, and she says high fat is so good for the brain. And as you're mentioning, depression, anxiety, all that gets fixed, alleviated when you eat the high fat. Dr. Ovadia, a question for you relating to the tests. What are the 5 metabolic tests that people need to test for to test that they're in good health, apart from the LDL?
Yeah, so the 5 basic markers of metabolic health are your waist circumference, your blood pressure, your HDL cholesterol, your triglyceride level, and your glucose. Your either your fasting glucose or your hemoglobin A1C level. And those really are the basics. But most people probably, have that information. They just sort of need to pull it together, right? Because you can go every time you go to the doctor, you get your blood pressure checked. You can measure your waist circumference at home. You just need a tape measure. And HDL, cholesterol, triglycerides are on that basic lipid panel. Your doctor may not pay attention to those because they're so distracted by the LDL level, but they're there. And, again, your fasting blood glucose level or your hemoglobin A1C are usually part of kind of the standard blood panels that people get checked. So that's a great starting point, right? I don't think it's quite enough. I always tell people go beyond that. But, when I'm talking to people at first and they haven't heard about any of this, I can at least say, well, show me these numbers, and that can give us indications about where your metabolic health, what level of metabolic health you're at.
Perfect. Okay, let's turn our attention to foods. We need to know what we need to eat. Let's play a game. Which is better for the heart, this or that? Dr. Ovadia, what's better for the heart? Orange juice or black coffee?
Black coffee, I would go with every day.
I just want to say on the orange juice real quick, I hate orange juice because it's a liar. It's like orange juice is basically sugar water. I think there's the same amount of sugar in orange juice that there is in Coke. But like people will wake up in the morning and they're not going to usually chug a Coke, but they're like, I'm going to chug an orange juice, and it gets a pass because it's a health food. But it's it's a lie. It's masquerading as a health food. It's sugar water.
Kerry, what about you? Oatmeal or bacon? What's healthier?
100% bacon. Oatmeal spikes the blood sugar. It's processed, all sorts of issues. Glyphosate.
Okay. Dr. Ovadia, whole grain toast or a hot dog?
I'm going to take the hot dog. Again, you want to make sure as best you can, some hot dogs have a lot of extra stuff besides the meat in there, right? And this is one of the reasons that meat gets demonized, because they look at something like a hot dog that might have sugar and other stuff added in it, and they call it meat. And it may have a negative impact, not because of the meat that's in the hot dog, but because of the other stuff and the bun and the toppings. But whole wheat toast is just another form of carbohydrates, processed carbohydrates that are going to lead to things like insulin resistance and heart disease.
That might be shocking for some. Whole grain, but the doctor has told me that the whole grains is good. No, maybe a hot dog is better, and that might be surprising for some people, hence why we're having this game. Back to you, Kerry. Butter or margarine?
Butter, 100% natural. Margarine is a chemistry experiment trying to resemble food. It's not real food. That's the biggest thing I've learned on this journey is whatever is natural, ancestrally appropriate, we've been eating for a long time, that's what's good. So definitely butter.
Do you have any favorite butter brands? Only because I've heard some variations in our favorite brands that they're reducing the butter fat content, or they're adding skimmed milk powder or different things. Any favorites that you have?
I've been partial to Kerrygold butter.
Oh, Kerry going for Kerrygold butter. Who would have thought? The salted or
Right?
unsalted?
Unsalted.
Love it. Oh, I like salted. Okay. Dr. Ovadia, as a heart surgeon, what is the absolute worst food that you think is going to destroy the heart?
I think any, form of highly processed carbohydrates, right? And so this can be obvious things like candy and cake, right? That I think most people understand are not good for their health. But, you've brought up a couple, right? That people would be very surprised about, oatmeal, whole wheat toast. And these are just processed carbohydrates that if you are already insulin resistant, which the majority of people are, they're going to worsen things and certainly are going to be contributing to heart disease.
Yep, it wasn't a trick question. I just think that for these, so-called people think they're healthy foods and they're still eating it. I mean, I can't tell you how many people have an egg on a whole grain toast or an orange juice, and that's their breakfast. And then they go out and think a hot dog is bad for them. But as we know, if we can lean more towards the fatty red meat and the butter and stay away from the processed carbs, that's going to be better for our heart. And we want good heart health. Kerry, what do you think about everything in moderation? Eat a balanced diet.
Yeah, I disagree with that. And I think it's really harmful information when 9 out of 10 of us have poor metabolic health and people are walking around. I think a big part of the problem is addiction, and people don't talk about that with food like we do other addictions. But you can't moderate any addiction, and you have to eat food. So trying to tell people to moderate their addiction to food is just crazy. I also just like thinking about there's millions of species on this planet. Not other species has to add things in and moderate just for the sake of it. They just eat whatever is appropriate for them, and they're thriving. So I'm not for moderation. I'm for eating what is appropriate and proper for humans.
So when we talk about a heart healthy diet, Kerry, what do you eat in a typical day? What foods are you eating?
For the most part, lots of red meat, eggs. I eat eggs pretty much daily. So beef, butter, bacon, eggs, a little bit of bacon here and there, but mostly red meat.
And when was the last time that you had a fruit or a vegetable?
Well, it's been over 1,000 days for sure.
You haven't had one fruit, one vegetable, no cheese. No, really? You've been that's amazing.
Yeah, they give me a hard time sometimes. Oh, Mr. Perfect hasn't cheated, but I was so sick and on all this medication. And when I did ketogenic diet for like 10 years, I would have cheat days, and I always regretted it. It would turn into sort of a binge. And so I was pretty much begging for any sort of relief when I found carnivore. So yeah, I haven't had anything. I just water, beef, eggs, bacon. That's been it.
I think that's many people, they try to do carnivore and they ask, well, can I have a cheat day? What can I get away with? Especially the holidays are coming. Dr. Ovadia, what is something that you eat every day? I know you said you're not strict carnivore, but what's a typical day of eating?
Yeah, I mean, again, for me, it's going to be almost exclusively red meat, and I do incorporate dairy, which I know is something that some carnivores don't do well with. I eat lots of eggs, but I eat cheese, yogurt, things like that. Um, and my non-strict carnivore stuff might be something like last night I made peppers stuffed with a mix of brisket and cream cheese, right? And wrapped in bacon. They're called Texas Twinkies. And my family and I love them. So we had that last night. And, I know the peppers aren't strictly carnivore. I might have an avocado here and there. I have some nuts on an occasional basis. But if you really looked at, an average month or week for me, it's going to be 95% red meat, fatty red meat, and it's going to be some dairy and some other stuff, like maybe some peppers and things like that.
It's not too far away from carnivore. What do you think as a heart surgeon about salt? Is that allowed to have liberally if you're following a ketogenic diet?
Yeah, I think it's important to make it a good quality salt, right? The table salt that most of us, grew up with and is most familiar with, that's a processed food. They've stripped out a lot of the minerals. They've added in things, you see it iodized and, all of this stuff to fortify it. But if you get a good natural, salt, a natural sea salt or Himalayan, something like that, that is in no way harmful. And most of us need more of it. Again, similar to the cholesterol story, salt has been demonized. Um, and the reason that salt shows up as harmful for health in the scientific studies is that the vast majority of salt in people's diets is within these processed foods, and it's the processed salts. That is very different than taking a good, you know, Himalayan salt or a good, sea salt and putting it on your steak. And most of us could use more sodium, right? Which is one of the beneficial components within the salt. We just need it in that non-processed form. And so, yes, liberal use of a good quality salt is something I encourage as a heart surgeon, as a heart doctor.
Perfect. And as a heart doctor, what do you think about fasting for the heart? Is it good?
I think it can be a good tool. It needs to be used, kind of figure out where it fits within your overall plan. We talked about earlier that ketones are good for the heart, and fasting is one of the ways that you can raise your ketone levels. It's not the right answer for everyone. I see a number of people that are sort of struggling trying to do low carb carnivore diets, and it turns out they're under eating, and they're too focused on, they're trying to do too much fasting. I kind of like to get people to a point where you can listen to your body's signals, and you eat when you're hungry and you eat until you're full. And on a carnivore diet, that's oftentimes going to end up being you're only hungry once or twice a day. So you end up doing fasting. There are some people that, have real bad insulin resistance and they're overweight, and, doing some extended fasting can help get them sort of over that hump. So it's a tool to be used. It doesn't mean that everyone needs to be fasting extensively all the time. And, sometimes I see people, right, that are almost, kind of what Kerry was talking about earlier, right? It becomes their addiction, right? Their food addiction instead becomes a fasting addiction, and they can overdo these things. And sometimes that has negative consequences. So it's not as easy as fasting is good or bad. I just view fasting as one of the tools that we can use when we're trying to improve people's metabolic health.
Perfect. And Kerry, do you do fasting? Do you eat once or twice a day?
I eat twice a day. When I started my carnivore journey, I did fasting. I did a 3-day fast, 5-day fast, 8-day fast when I had more weight to lose. And I felt great doing it. I just always go by the rule, whatever is sort of ancestrally appropriate. And I feel like out of necessity, humans have fasted since the start of time. It's interesting when you talk about fasting, a lot of people are like, that's crazy, or you can't do that, it's nuts. It's like, since the beginning of time, that's what we've been doing. We didn't have access to food, just like snapping our fingers all the time. So I felt great fasting, but yeah, now it's just more intermittent fasting, eating 1 or 2 meals a day.
Yeah, it's interesting when they talk about fasting and they think, oh, it's bad for you. Same with red meat. So it seems like eating the red meat, eating the butter, and doing some fasting is actually really good for your health and really good for your heart. Final question for you both. Kerry, what would you tell somebody that is curious about carnivore but really scared to start?
Yeah. Well, if you're scared, it's usually just lack of knowledge. So I would encourage you to do more research before you start. But just rest assured that whatever you're scared of, those questions have been answered. I was scared of starting because of my heart disease. And this is a true story. I learned about carnivore through Dante Ferrigno. I watched a bunch of Dr. Berry videos, but I was still nervous because of my heart disease. And then I found Dr. Ovadia and I read his book. I saw him on Diary of a CEO, and I'm like, that's what ultimately convinced me to start. So if you're scared about starting carnivore, I would also say you should be scared of whatever led you to consider carnivore in the first place, because that is a lot scarier. Inflammation, insulin resistance, walking around in a brain fog. It's just such a shame that so many people will go their entire lives never like really living. If you're walking in that brain fog and you got aches and pains and ailments and issues, give it 30 days, try it. It'll change your life forever. I've seen it over and over and over again.
So how many more days is Kerry going to be carnivore? Is there another 1,000 days coming?
I'm carnivore for the rest of my life. In fact, someone asked me if you were on death row and you had one more meal, what would you have? It would be a fatty ribeye. I wouldn't even, just out of principle, I feel so good doing this. So yeah, I'm doing this for the rest of my life. And I will say this too, I really believe I'm probably going to live 20 or 30 years longer than I would have otherwise. I think we're all dying far younger than we should. We're happy to get to 70 or 80, and we're dying decades before we should, and we're completely oblivious to the fact that we should be living longer. So yeah, I'm a lifer for sure.
Absolutely. Dr. Ovadia, what would you tell a doctor about carnivore or a ketogenic diet?
The conversations I have with doctors are largely these days along the lines of, are you actually happy with the results that your patients are getting, right? Are you happy just managing their disease? Are you happy, seeing them continually get worse? Because I now see in my practice the exact opposite. Patients are truly getting better. Patients are getting off of their medications, and they're reversing things like diabetes, heart failure, high blood pressure, all of these conditions that I believed couldn't be reversed, couldn't be improved. And so I can now have that conversation with physicians that we can do better for our patients. And that's ultimately what doctors want, right? Doctors aren't sitting here thinking, well, I don't want my patient to get better. Doctors want patients to get better. They just don't understand how to do that. They don't realize that it's possible in many situations. And so that's really the conversation that I find myself having with other physicians these days.
Perfect. Great advice from both of you. What is your new book that's coming out, Dr. Ovadia?
Yeah, so it's going to be called "Stay Off My Kitchen Table." It's going to be I now say that stay off my operating table is what to do. Stay off my kitchen table is why to do it. And I'm very excited about it. It is going to have what may be the most controversial book chapter of 2026. I'm going out on a limb and saying that. It's chapter 7, and it's about why the vegan diet is not the answer. And we go deep into that. But stay off my kitchen table. If people go to ifixhearts.com/primal, if you pre-order the book, which is now available for pre-order, I'm going to send you a free ebook copy of Stay Off My Operating Table, the first book. So like I said, my purpose in writing the first book and both books is to get this information out to people. So you can go pre-order the new book. You're going to get the previous book for free, and really excited to get this second book out. It's going to be released in July of 2026.
Well, I just want to go to your website and get my copy as well. I'll leave all the details in the show notes so people can grab your older book, Stay Off My Operating Table, and the newer book, and pre-order that one. That was interesting that you said about vegans, a chapter of vegans. Do you think vegans have smaller brains because they don't eat fat and meat?
I think their brains are suffering because they don't get the right fats and the right nutrients. And, again, it's Kerry had an experience, right, adjacent to this. The saturated fat is, you asked earlier, right, is it harmful to our health? And I think what we're really starting to understand is not only is it not harmful to our health, but it is actually essential for good health. And I have truly come to believe that. I think that's what the evidence shows us. And there's just no getting around that we evolved as human beings eating fatty red meat, and it is necessary for optimal health.
Perfect. After this, I want to get my butter and eat some more saturated fat. Kerry, how else can we support you? Is there your documentary, anything happening for you?
Yeah, so I've dedicated my life to sharing these stories of healing. We've filmed 400 hours worth of footage, 60 interviews all over the world of people who have found incredible healing like I have. We're editing our documentary through the end of the year. It's going to be out early next year. And if people want to watch our newest trailer, they can do that at healinghumanity.movie.
Beautiful. Well, thank you both so much for being here. I think people are going to get the information from the doctor, the heart surgeon, and the real life patient. There is so much information, trust, and motivation to change your health. Thank you both for your time.
Thank you.
Thank you, Rena.
If you want to understand more about cholesterol and LDL better, watch this episode next with Dr. Zoe Harcum. Don't miss it, and I'll see you next week.